Ready na.
Okay. Hi, my name is Evelyn Brewster, and I've been here since 1987. So figure it out. I've been here for maybe less than 25 years. Okay. I'm an RN here and an RN over in the Philippines. But I haven't renewed my license over there. So I'm only an RN here. Now, one of the questions here is, how can you describe the difficulties when it comes in caring a foreign patient? Tagalogin ko na lang. The thing here is, when you're caring for your patient, it's not only the patient that you're caring for. It's good when the patient has no families, but when they have families, then you are also taking care of the family. Also, people here are so oriented. So, magkamali ka ng konti, reklamo ka nila. Malpractice is number one here. So, if you work here, make sure that your company covers you for malpractice and you have your own malpractice too. 1 million at least. Now, another question is, back in the days before you left the Philippines, what were your expectations in working as a nurse overseas? Teka, nininervyos ako eh. Okay, what were my expectations? Money. Money was the number one. Of course, back in those days, nursing here is so, how do you call that? Easy. You can have 2 or 3 jobs depending on your physical ability, mental ability, and the time that you have. I had 2 or 3 jobs before, working as an ER nurse, an IV therapist, and an agency nurse. So money was in abundance. That was back in those days. Right now, I would say they made it a little bit harder. Yeah, because of the computers, you have to know a little bit of computer. I am an illiterate when it comes to computer. I know a little bit, not totally illiterate, but if you are a nurse in the Philippines, before you come here, you should at least have the basic knowledge, because when you take the exams, you will be using the computer. All hospitals are now computerized, so, you know, the difficulty there is. But they give trainings. Yeah, they do give trainings, but, you know, training is like maybe a week, 3 days or so. So, you will, if you're not interested in computer, it will be harder on yourself. Now, what else should I say about my expectations? Also, before, once you become an RN, you can apply a second job right away. You can have 2 or 3 jobs right away. Now, they do a lot of they have a lot of requirements like background check. Of course, if you have the necessary papers, you need to have a green card. Back in those days, if you cannot pass the RN boards, you can take the LPN boards, but now you cannot take anymore the LPN if you cannot pass the RN boards. So LPN is out of the question now. Another question, language barrier is one of the problems when taking care of foreign clients. What did you do to overcome that conflict? How did you adjust from it and provide your quality nursing care? First of all, Filipinos have no problems communicating in English, because that is our medium of instructions. We do know how to write in English, and we do know how to communicate in English. Basic, but as you go along, you become more, how do you call that? Help me out.
They do have the phone natin also for Spanish speaking.
Oh yes, but you know, 90 or 95% of your coworkers are Americans because you're in America. So you have no way of communicating with them but in English. So you get used to it. In my part, I married an American. So I got used to it. You know, also, you know, you open the TV and everything is in English unless you go to the Spanish channel. You go to the movies are all in English. And, you know, almost everybody around speaks in English, so it's not a problem. It's our second language here, but of course, Filipino is our main language. And some of the hospitals now prohibits us from speaking in our own language, especially around the patients and other co-workers who could not understand. They say it's rude, you know. Okay. Another question, can you share some experiences wherein you encountered what we call culture shock or scenarios where you observe your client's culture which really differs from ours? Okay. I would only talk about scenarios in the hospital. Culture shock because one of the things is families don't take care of their residents. They do visit. They don't do bedside. It's always the nurse or the CNAs who does the dirty work. It's so different from our country or our culture because Filipinos do take care of the patients who are in the hospital or who are sick. And one of the things that I observe is this. There's a lot of patients who develop pressure sores over here. In the Philippines, I have never seen a family member developing pressure sores because we really take very good care of them. Right? Yeah. So the first time I've seen those pressure sores, I was really shocked.